102.9 WDRC-FM. It's Jerry Kristafer, Saturday morning on the Big D. And joining us in our guest spotlight this morning from Bristol Hospital is the Director of Emergency Medicine, Dr. Craig Mittleman. How are you this morning?
I'm fantastic. How are you, Jerry?
Excellent. Carbon monoxide poisoning. First of all, explain to our listeners, Doctor, exactly what it is and how it affects the body.
Well, carbon monoxide is a gas that is produced by a lot of mechanical engines that burn gas or kerosene or other flammable element. And like your car, carbon monoxide produces a gas that is very, very toxic. When you inhale carbon monoxide, it actually competes with your bloodstream for oxygen. So one of the consequences of that is very dangerous this time of year is that your body needs oxygen, but carbon monoxide will bind with the red blood cells more tightly than oxygen does, depleting your body of oxygen.
So when we hear about people after the hurricane and the storms and the power outages using generators, this can be a real problem.
Yeah, generators are a big problem, particularly after Irene last year, the snowstorm, and more recently with Hurricane Sandy. People have been struggling to find generators, and one of the problems is that people have also taken some of their camping tools like camp stoves or propane heaters inside the home. Obviously the generators are the big issue, and one of the things that we're trying to alert our public to is to keep and make sure that your generators are kept at a reasonable distance from the house, that they're well ventilated, and by all means you can't keep them in the house.
Now, how does one know if they've been exposed to carbon monoxide and have the symptoms of poisoning?
Well, symptoms of poisoning are fairly diffuse and very nonspecific. They can start out as a dull, throbbing frontal headache. They can be associated with nausea, weakness. You can see children are often very affected as well and can be acting differently or ill appearing. One of the things that's happened over the last several years is the availability of carbon monoxide detectors in the home, and they're easy to get. They're very effective as long as people keep their batteries alive, can be very helpful and life-saving. So I think many people have actually gone to the store. They can be bought at your local hardware store, any of the local home improvement facilities, and there's good instructions on where to place those in the home so that you can actually detect carbon monoxide in the home well before this becomes an issue.
All right, if it is affecting someone in your family and you see the symptoms, how are they treated?
Well, the first thing to do at home is obviously, as you're trying to highlight, is recognition. So if you think there's a problem or you think that you might have carbon monoxide toxicity, if you think you've put yourself at risk, the first thing to do is to get out of the area. The second thing to do is to dial 911 and enlist your fire department. They're happy to come over and check your home for carbon monoxide levels, and they have detectors that are very, very accurate at doing so. If you continue to have symptoms or you have any symptoms at all, while the house is being checked out, it would be very important to go to your nearest emergency department and be evaluated. If, in fact, you get to an emergency department and you're found to have carbon monoxide levels that are elevated, the first and most important treatment is oxygen. Many of those patients who present to hospitals across our state, unfortunately, with high carbon monoxide levels are placed on 100% oxygen. There are a few indications for people with carbon monoxide toxicity to actually get what's called 100% oxygen under pressure. That many patients who come in with carbon monoxide toxicity are treated just with simple oxygen alone.
Dr. Craig Mittleman, Director of Emergency Medicine at Bristol Hospital. Thanks for explaining a little bit more about carbon monoxide poisoning to our listeners, and hopefully you might have prevented a few cases from coming to Bristol Hospital.
That would be fantastic.
Thank you, Doctor.
Thanks very much.